Good morning, everybody. I'm Dr. Michael Richmond, a double board certified cardiothoracic surgeon. So cholesterol-lowering statin medicines have long been hailed for their ability to reduce the risk of cardiovascular events such as heart attacks and strokes. However, recent research has suggested that these drugs may also play a role in protecting the heart during chemotherapy treatments in women with breast cancer. The potential cardioprotective effects of statins have generated considerable interest within the medical community, as it has the potential to improve the overall cardiovascular health of these patients who are also suffering from cancer. So, do I take a statin? Yes, but I take it for high cholesterol, and I think everybody should be on a statin. But regarding chemotherapy, while effective in treating cancer, it has been linked to an increased risk of cardiovascular complications such as cardiomyopathy, which is failure of the heart muscle, congestive heart failure, and arrhythmias. These cardiovascular side effects have been shown to be more pronounced in women receiving certain types of chemotherapy, particularly anthracyclines such as doxorubicin, adriamycin, epirubicin, and trastuzumab, which is Herceptin. Several studies have provided evidence to support the potential cardioprotective effects of statins in women undergoing chemotherapy. For example, a retrospective cohort study by CCN et al. In 2017 found that statin use was associated with a reduced risk of cardiotoxicity in women receiving anthracycline-based chemo for breast cancer. Similarly, a meta-analysis by Kalim et al. In 2018 demonstrated that statin therapy was associated with a lower incidence of Herceptin-induced cardiotoxicity in breast cancer patients. These findings suggest that statins may have a protective effect on the heart during chemotherapy, potentially reducing the risk of cardiac complications. In 2021, an article in the premier journal of the Journal of the American Heart Association noted that women who take statins for lowering cholesterol and who are also getting chemotherapy with anthracyclines for early-stage breast cancer are half as likely to require emergency department visits or hospitalizations for heart failure in the 5 years after chemotherapy. Researchers say in conclusion that statin use should be encouraged in women starting potentially cardiac toxic treatments for early-stage breast cancer if they already have indications to take them for heart disease. I personally feel, like I said, everybody has the potential for heart disease. It's the number one killer, so you should be on them definitely if you have breast cancer. While the evidence supporting the potential cardioprotective effects of statins in women undergoing chemo is promising, it's important to note that additional research is needed to confirm these findings. So, how do statins work? Well, aside from lowering cholesterol, they have anti-inflammatory, and they're an antioxidant. And I think, and they also stabilize plaques. So given that these drugs, these cardiotoxic drugs work by different mechanisms, it's a plus. So you're on it for your cardiovascular health. And, there is an abundance of literature that I did not quote everything that show it does reduce cardiac complications. I'm not going to talk about its effect in other cancers, which has been shown to reduce metastasis and advanced stage cancer progression more slowly. But I hope you learned something today. I hope everybody has a great day. Thank you so much for listening. If you need more information, you can go to my website, www.paladinmds.com. And thank you.